Additionally, PQA Innovation Theaters are opportunities for PQA member organizations to showcase their innovations, technology services, and research in a unique forum. This is an opportunity as an audience to learn more about these solutions in the marketplace. And we are thrilled to finish the 2020 Innovation Theater series today with DocStation. Our speaker today is Samm Anderegg. He is the CEO of DocStation and committed to enabling pharmacists to provide value-based patient care through innovative technologies. I've known Samm for many, many years, back when we were just kids working in a health system, so it's exciting to see where he is now. Samm joins us today to discuss how DocStation and the DocStation platform will bridge us to value-based pharmacy services. So Samm, we're excited to learn more.
Awesome, thanks Jake. Appreciate you. Hope you can hear me all right. Hello everyone. I'm going to advance to the next slide here and get it kicked off. So hello from Austin, Texas. Welcome to my home. We are in the live music capital of the world. We are also home to one of the fastest growing coronavirus infection rates in the country. As Jake said, my name's Samm. I'm a pharmacist. I started my career as a hospital administrator and have spent over 10 years in healthcare IT. I had the pleasure of working with PQA, AMCP, and a variety of other associations to advance pharmacy practice through technology. So almost 5 years ago, I took a leap. I saw what was going on, how healthcare was shifting, and realized that pharmacy, our profession, wasn't prepared for the future, and I was scared. And I decided I wanted to dedicate my career to making sure that we were ready for the future. So today, I'm really excited to introduce you to DocStation, a software platform that we built for value-based pharmacy. So at a high level, what are we talking about? What is value-based pharmacy? Are we talking about value-based contracts for gene therapy? Well, in reality, it's super simple. So pharmacists are providers. They manage patients. We're focused on preventative care and also optimizing therapy. And when we do that, patients stay healthy because their treatments are safe, effective, affordable, and they lead to better outcomes. In turn, payers save money. Better metrics and lower costs strengthen profit margins. We've been at this for years and years and years. And we've seen countless studies, I'm sure Jake's published some of them, that show pharmacists improve outcomes. But if we really want to make this work, we have to show it in the live environment. We have to make it work in practice. So early on, we found partners who shared our vision that had existing models in place. And in my home state of Iowa, we built tools for pharmacies to participate in value-based program that reduced combined pharmacy and medical spend by 4%. Okay, so maybe we can make it work in practice, but if we really want to make it work, we got to figure out how to do it at scale. So we worked with pharmacies across 7 states to implement a value-based payment model. And an interim analysis of this program showed a 2% reduction in combined pharmacy and medical spend. So how do we make this the new standard of practice? If we really, really want to make this work and make it sustainable for the future, we've got to make it the standard of practice. So we built DocStation to be a turnkey solution that helps health plans and pharmacies operationalize value-based programs at scale. So that all sounds great. How does it work? So I'll tell you. So we take existing health plan data, so not just pharmacy claims, medical claims, and eligibility files, and there's some really rich data in what's existing in health plans. So we take that and we do three important things with it. The first thing that we do is we curate individual member profiles. You can think about it like an EHR profile. Problem list, med list, immunization records, allergies, and we attribute those members to a primary pharmacy provider for ongoing management. The second important thing that we do is we built clinical intelligence on top of all this data, so we can serve up clinical opportunities to pharmacies for evaluation, for intervention, and to mitigate risk. The third important thing that we do is we combine that claims data with the clinical documentation entered by pharmacists throughout the course of care to report hybrid quality measures in real time. So we can track quality, progress in the program, overall outcomes. So if you break it down kind of into simple steps, pharmacists target these quality measures for their attributed population. So we get these metrics that the health plans care about and show the pharmacies how they're doing with their patients. We assist the pharmacists in doing this and help them drive workflow with this clinical intelligence that tells them when to intervene. So a great example of this is our non-adherence task that we built. Non-adherence doesn't just focus on the 3 drug classes that are associated in STAR measures. It's across all chronic medications. So we had a non-adherence task trigger to a pharmacist in rural Montana, and they called up, the member, the patient, and said, "Hey, Mrs. Jones, I noticed that you're not taking your gout medication regularly anymore. What's going on there?" And Mrs. Jones said, "Well, I'm just not having a whole lot of pain associated with my gout anymore. It's not really an issue for me. But there is something else that I wanted to talk to you about. I ran out of my nitro tablets. I've been taking about 5 a day for the past week, and I need a refill." So huge red flag. The pharmacist coordinated an emergency visit with the cardiologist, prevented what could have been a hospitalization, and potentially much worse. So just an example of how this clinical intelligence supplements the engagement with members to mitigate risk. It's all about aligning incentives. Value-based pay-for-performance models don't incentivize pharmacists to simply check a box once or twice a year. Pharmacists are paid to actually improve outcomes. So how do we actually operationalize these value-based models? There's 3 steps. So the first is design. We've learned that every health plan is unique. You have unique goals and metrics that you're trying to hit. Well, we want to know what those are so we can help you achieve them. You might be running an MTM program and you need to improve adherence on diabetes medications. But you also are running a Medicaid program that really needs to reduce asthma-related hospitalizations. We give you a platform to manage all your programs across all business lines in one easy place. So breaking this down into bite-sized steps, which populations should we focus on? The Medicare patients, Medicaid patients? Maybe you're trying to run innovative programs to offer to employers. Next, are there any requirements that we need to meet? Do you need MTM encounter reports, supplemental reports to meet accreditation requirements? Maybe you're trying to integrate pharmacists into ACO programs and need to provide special reports to the employers involved. So then what are we trying to measure? What is it that we're trying to improve? Are we testing an experimental PQA measure? Are we looking at tried and true STAR measures? Maybe we're focused on HEDIS measures. We were talking to a Medicaid plan, someone that was working in an MCO, and we said, what are you measuring? What's your what's success look like? And she said, well, we use HEDIS measures kind of, but they're HEDIsh measures, so they're customized. Like, are you trying to look at something unique that maybe isn't a standard measure? We can do that. And finally, when do we want to launch the program? So this helps us develop an implementation timeline. So speaking of implementation, implementing a value-based payment model, program, coordinating pharmacy networks, that all sounds really complicated and really hard to do. It's going to require a lot of resources. It doesn't. We make it super easy. You send us the data and we take care of pretty much everything else. Let's talk about that a little bit. So the first thing is just integrating your data. So we set up a data link. We can get super fancy with APIs and pull things over in real time. If you looked at some of the requirements coming out of the federal government, all payers have to implement an API and make patient data available to members by 2021. We can help with that, but when it comes down to it, most health plans are comfortable doing a secure file transfer. So you drop in the files on a regular cadence, and within 24 hours, all that data appears in member profiles and updates performance measures. Next is we help you connect to a network of providers. Maybe you have internal clinical staff that needs to use the platform and manage members from a top-down approach, or maybe you're interested in connecting with community-based pharmacies. Regardless, onboarding takes 30 minutes. We've got some really great people doing onboarding. We've got a pharmacy technician, we've got a nurse, we've got a pharmacist, all of them there to help you get onboarded, but it takes less than 30 minutes. And if you have questions along the way, you're in workflow, something you're curious about, you can type it directly into the chat box, and the same people that onboarded you respond within 5 minutes. The next thing we do is payments. So at the end of every month, if you have a network of providers, we take a snapshot of performance across the entire pharmacy network. We calculate and then distribute value-based payments to these pharmacists. Super simple, it's easy. Actually, it's super complicated. We just hired a whole bunch of engineers that are really smart and built it out. It just works. The final step is optimization. And this is an ongoing step. We provide data to help you track performance across all your programs in real time, at the plan level, down to the individual pharmacy level. You know exactly how your program's doing and determine where you're going to end up at the end of the year. We also help you measure and calculate that hard ROI. So how are costs doing? How's utilization doing? In summary, our goal is to provide one easy place to manage all your clinical programs, align all incentives for all stakeholders, the payer, the provider, the pharmacist, and of course the patient. So together, we can achieve better outcomes at a lower cost. Really appreciate the opportunity to talk to y'all today. Throw it back over to you, Jake.
Well, thank you very much, Sam. Thank you for sharing this presentation with us and letting us see the work that you're doing to transform lives and show the value of community pharmacy in partnership with payers. So when we think about this service, you know, what's the reaction from both payers and pharmacies? You know, are they resonating with this? What are they saying? What's the street say?
Yeah, so what we're seeing when we're talking to payers is, you know, they're thinking about pharmacy differently. You know, in the past, it was kind of a cost control mechanism. How do we keep pharmacy costs down? But now, again, as the entire healthcare environment is shifting to value-based care, where is there untapped value? And the plans that we're talking to see it in community-based pharmacies. You know, they're talking to patients not 4 times a year like a PCP, but 34 times a year. They have those relationships. You know, when things actually need to change with the medication regimen, when they need to get them on some sort of preventative care measure, do some screenings, they trust the pharmacist. And so we just need a way to incentivize pharmacists appropriately to do the things that we believe lead to better outcomes at lower costs. On the pharmacy side, when you're getting started, early on, like years ago when we were getting started, had to beg pharmacists to use a new platform, right? Because if you ever worked in a pharmacy, you're using 6, 7 different platforms to manage patients, manage prescriptions. So we knew that would be a huge barrier, but over time, we really listened to these users and we said, what's working? How can we make this better? How can we make this more efficient? And so on the product side, we make updates and make changes all the time. So we measure pharmacist engagement by the percentage of these clinical opportunities that we send them, what percentage of them are addressed. So we started around 20%, and then we worked and we eventually got more accurate with these opportunities that we sent down. And for the last 3 months, we've actually had a record month. 90% of all opportunities have been addressed by pharmacists. And they're asking, how do we get this program on the platform? How do we integrate with this dispensing system? So it's been an ongoing process, but we're really seeing a lot of satisfaction from the pharmacies and from payers.
That's awesome and really, really exciting. Great to hear that this is resonating with a variety of stakeholders within the industry. And so we only have time for one more question. And when you kind of pointed out your model, you are really providing care holistically to that population health. You're hitting all the major lines of business: commercial, Medicare, Medicaid. But if you're a community pharmacist and you're supporting your team members, what line of business do you think that they have the most potential to influence? Like, who should they target first?
I think it really gets down to who are your partners in your region, right? I think Medicare patients, the amount of high spend that they have, there's a real opportunity to impact total cost of care there. Same with the Medicaid population, an often underserved population. How can we control costs early on so it doesn't lead to extraordinary expenditure later on? But really, what it comes down to is, I'm a pharmacist. I'm in, Wyoming, for example. Who's the payer, the employer, or the group that is interested in working with me on some sort of program where I can demonstrate my value? And when you see that sort of alignment, that's a perfect place where we can come in and we can help you operationalize something like that. So that's what I think about that question, Jake.
Awesome. Thanks, Sam.
Yeah,
so unfortunately, we're a little bit out of time. We're going to transition to our next presentation. But again, Sam, thank you so much for sharing your story and helping us better understand DocStation and everything that you do.